Part 3. Fight your depression with knowledge about behavior. Work against your avoidance. Avoidance is a key component of depression. Earlier, we spoke about social withdrawal, which is a kind of avoidance of positive social interactions. People with depression often avoid activities they used to enjoy or avoid dealing with problems that affect their quality of life. Avoidance can be hard to identify because it doesn't look the same for everyone. Here are some examples of avoidant behavior. Situational avoidance. Staying away from situations that trigger discomfort. For example, avoiding doctor's appointments, exercise, activities that used to be joyful like going to the movies or attending a sports event. Examples of cognitive avoidance: denial. Pushing away certain thoughts and avoiding them, saying to oneself, "No, I will not think about that." This only makes the thoughts return again and again. Denial is about refusing to acknowledge that there are certain problems in your life that are solvable, often referred to as a learned helplessness, and can also include excessive joking and minimizing or trying to reassure others that there is no problem. Due to the changes in the depressed person's cognition, they also struggle with indecisiveness, constantly worrying about not making the perfect decision instead of just giving it a try and learning from it. Procrastination. A depressed person is prone to delaying or putting off the pursuit of goals that are important for personal growth or for improving their quality of life. Instrumental avoidance. Numbing feelings and using alcohol or drugs, food, sex, shopping, or online activities in order to reduce stress. Venting and complaining. Venting your frustrations about certain people or about situations is normally healthy and necessary for our psychological well-being. But constantly complaining about people and situations is a sign of avoidance and will not help solving a relational or situational problem. Avoiding hope refers to putting yourself in a position where you choose not to have hope. For example, avoiding necessary healthcare treatments. Exercise. Reflect and try to identify any avoidance areas you can work on. Try to not think about a blue elephant for 1 minute. Most of us find this hard, if not impossible. This is because our brain is wired to remember what we're not supposed to think about. In situations like these, it's better to accept the thought and let it be. Set aside time for these thoughts later. Fight passivity with exercise. If avoidance and passivity are friends of depression, activity is an enemy. Depressed people tend to feel heavy due to physical passivity and avoidance. Physical activity increases blood circulation and affects several signal substances in the brain. Physical activity can also help deal with other types of avoidance due to the positive effects exercise has on depressive behavior. The brain releases cortisol during physical stress, but if there is no threat, the cortisol quickly declines. The cortisol released during exercise suppresses the subsequent cortisol response for future stressful situations. In other words, the positive stress response you receive from exercise protects you against future stress. Exercise also increases the release of endocannabinoids, which reduces anxiety and increases the availability of serotonin. This in turn promotes a regulation of feelings. Therefore, exercise can help you tolerate stress better. It can reduce anxiety and low mood. One single exercise session for about 30 minutes can improve your mood for 24 hours. Exercise has one more positive effect on depression. It increases the brain's ability to learn by releasing BDNF, or brain-derived neurotrophic factor. Learning is crucial in depression. because we can often feel trapped in the same old thinking patterns when depressed. By enhancing BDNF with exercise, we feed our brains with a kind of learning vitamins, which can be helpful when trying to change our behavior or learn to work with our thinking behaviors. See through your negative self-focus. A lot of people experience a lot of negative focus about the self during a depression. Negative self-focus feeds and maintains low self-esteem and thus depression. Everything that has ever happened in your life has one common factor: you. Because your brain and senses process all the information you receive, you are naturally the main character in every event of your life. This naturally provides you with a lot of information about yourself. The downside is that it's practically impossible to maintain a similar focus on other people as main characters. Having significantly more information about oneself makes us overestimate the importance of our contribution, in turn heightening our self-awareness. The more self-aware we are, the more likely we are to inhabit a negative self-focus when depressed. Exercise. When engaging in negative self-focus, direct your focus outward. Ask yourself, am I overestimating my role or responsibility in this situation? What other factors play a role here? Emotional housekeeping. Develop self-compassion. Self-compassion is about treating yourself with kindness when you're going through a difficult time, failing, or noticing something you don't like about yourself. Instead of simply ignoring your pain, you pause and acknowledge, this is really difficult right now. How can I comfort and take care of myself? Self-compassion means being kind and understanding when confronted with personal failings, rather than mercilessly judging and criticizing yourself for various inadequacies or shortcomings. After all, whoever said you were supposed to be perfect? You may try to change in order to be healthier and happier, but you do so because you care about yourself, not because you're worthless or unacceptable. Perhaps most importantly, having compassion for yourself implies that you recognize and accept your humanity. Things don't always turn out the way you expect them to. You will experience frustrations, losses, make mistakes, and you will run up against your limits and fall short of your goals. This is the human condition, a shared reality for all of us. The more you open your heart to this reality rather than fighting it, the more compassion you will have for yourself and all your fellow humans in your life. Exercise. Self-Compassion Break by author Kristin Neff. Think of a difficult situation in your life. Something that's causing you stress. Call the situation to mind and see if you can actually feel the stress and emotional discomfort in your body. Now, say to yourself, this is a moment of suffering. That's mindfulness. Other options include, this hurts. Ouch. I'm in pain right now. Say to yourself, suffering is part of life. That's normal. Other options include, I'm not alone. We all struggle in our lives. Now put your hands over your heart. Feel the warmth of your hands on your chest. Or adopt the soothing touch that feels right for you. Say to yourself, may I be kind to myself? You can also ask yourself, what do I need to hear right now in order to express kindness to myself? Maybe there is a phrase that speaks to you in your particular situation, such as, may I give myself the compassion that I need? May I learn to accept myself as I am? May I forgive myself? May I be strong? may I be patient? This practice can be used any time of day and will help you remember to evoke self-compassion when you need it most. Sleep housekeeping. Individuals with depression often experience sleep disturbances, like waking up too early, waking up at night, or failing to fall asleep or get up. It's also common to feel tired all the time and wanting to nap, in turn messing up or delaying the sleep cycle. Sleeping more won't help us feel less tired. Too much sleep also increases avoidance and social isolation. Excessive sleep, for example 10 to 12 hours, increases the length of our REM sleep. This in turn is associated with depressive symptoms. So sometimes sleeping less than 7 to 8 hours can improve your mood. Exercise. Track your sleeping and try to induce nighttime sleepiness. Set the alarm for an 8-hour sleep. Earlier we talked about using alcohol and drugs to deal with feelings of depression. However, it is widely known that alcohol worsens depression and makes us more vulnerable to depressive behavior. Most recreational drugs are used to induce positive feelings or relaxation. After the high comes the low. This low mood after intoxication can induce anxiety and emotional pain and make us less cognitively flexible, thus making our mood worse. Reducing or eliminating alcohol and drug use is crucial in order to recover from depression. Eliminate alcohol and drugs for a month and see if it gives you more energy to work against depressive behavior. To summarize episode 3, in this episode we've learned more about different types of avoidance. We've also learned how to develop self-compassion and how different kinds of housekeeping can improve our mental health. These exercises teach us how to direct our focus away from negative self-focus in order to make room for a more realistic perception of ourselves and the world. We can't expect to live a life without pain, but if we recognize the depressive behaviors that worsen our pain, we can do something about it. Check us out on sio.no. There you will find contact information and learn more about our different services.